Well, the Food and Drug Administration is meeting later this week to discuss booster shots of their vaccines.
Meantime, drug maker Merck is asking the agency to authorize emergency use of its COVID-19 treatment pill. So as always, lots to talk about with UW-Heath's Chief Quality Officer, Dr. Jeff Pothof. Dr. Pothof, welcome back.
Good to be here. Yeah.
Let's talk a little bit about boosters, booster shots. Pfizer is still the only one that is available. So if you had the Moderna vaccine or the Johnson & Johnson vaccine, you have to wait a little while. Is that right?
Right, but probably not too much longer. So Pfizer's approved, but they're talking about Moderna and Johnson & Johnson this week. So if they decide that there is an indication for a booster of either the Johnson & Johnson or Moderna vaccine, we'll probably know about it in the next week or so.
So the FDA has to approve it and the CDC?
Yep, so the FDA does the first step of approving, and then there's that independent advisory council on immune practice that advises the CDC on whether they also think it's a good idea, might make a couple tweaks to what the FDA recommends, and then it's approved, and then the states get a chance to look at it and say, yeah, we want to do this for whatever state that you're in.
How much of the vaccine is in the boosters?
So for the Pfizer vaccine, it's the same amount as the original dose. For the Moderna vaccine, they're actually looking at a reduced dose that they have studied and found that it provides a really good immune response. So, you know, that's good news. You can get a little bit more kick for your immunity with less of a dose.
And where are we at with the 5 to 11-year-olds?
So right now they're planning to meet on October 26th to discuss the data that Pfizer submitted to the FDA to get emergency use authorization. A lot of us think that they will likely be granted emergency use authorization. Same thing, it gets approved by that independent body that advises the CDC. And I think we could see our 5 to 11-year-olds getting vaccinated maybe just in time for Halloween or the week after.
And that would be a big deal.
That would be a big deal because we're seeing a lot of infections in those school-age kids with school back in session. That would be a big relief to a lot of parents and could reduce the transmission of COVID-19 in those environments where those kids are all together.
October is traditionally the start of flu season, and I think one of the conversations going on in a lot of households is, can you get a flu shot at the same time you get a COVID shot or a booster shot?
Yeah, we hear this a lot. The answer is absolutely. So if you're one of those efficient people, you know, 2 birds, 1 stone, get the COVID in the right or the left and get your flu in the other arm, and you're good to go.
Well, the next day it might be a little sore.
Yeah, probably so.
Where do we stand in terms of, let's say, last March of 2020 was a 10 in terms of 1 to 10, as bad as it can get. Where do you think we are now on that scale?
You know, I'm optimistic right now. It looks like cases are starting to ease a little bit. If Delta would start to ease down, that would be good news. In the next couple months, we could find ourselves in a position that's more like May of this year where, you know, we didn't have to worry about distancing as much. Masks weren't as necessary. I think that would all be a welcome change. But, you know, the more folks that we get vaccinated, whether you're eligible and you haven't done it, get it. Those 5 to 11-year-olds, when they're eligible, get those folks vaccinated. That all contributes to us getting back to normal sooner.
Everything, statistics-wise, new cases are down, hospitalizations are down, and deaths are down, which is very encouraging news. Do you think we're getting the upper hand on the Delta variant?
I think so. In other parts of the world where Delta variant has kind of tore through, it's kind of a fast and furious thing where, you know, it burns hot for a few months and then it tends to taper down. And, you know, right now we don't have another Delta variant on the horizon, which is great news. Not that it couldn't happen, but, you know, hopeful going into fall, into winter that, you know, maybe we won't have as much problem with our COVID cases as we did, you know, late summer, early fall right now.
We heard a lot about all these different variants. They sort of fizzled out?
You know, we keep an eye on them, but none of them have the same kind of ferocity that Delta variant had. So important to watch these, make sure they don't mutate further and cause problems. But, you know, right now we're not hearing a story of another variant like we heard about Delta, you know, late spring, early summer that really took the world for round 2 or 3 of COVID-19.
That's really encouraging to hear. Are you seeing many breakthrough cases?
You know, we do see breakthrough cases, but I think one thing to remember, especially in a place like Dane County where, you know, 8 out of some 10 people might be vaccinated, there just aren't that many unvaccinated people left to get COVID-19. So we see these breakthrough cases, oftentimes pretty mild, unless you're of, you know, advanced age, over 70 years old, or have a whole lot of comorbid medical conditions. So they're out there, but, you know, for the most part, not causing a lot of trouble.
Are we going to reach the unvaccinated?
I don't know. I think it's hard to say. I think one thing that might do that is I think you're seeing society as a whole get really tired of this pandemic, and a lot of people realizing that the only way out of this pandemic is to get vaccinated, which is why you're seeing more mandates from employers and things like that to say, you know what, if you want to work here or if you want to engage in society, go to events, things like that, you got to be vaccinated because otherwise we just can't do it.
And can I just quickly ask you, how do you know if you have a cold, the flu, or if you need to get tested for COVID? Is losing your taste and smell unique to COVID, or does that happen with the flu too?
Yeah, so the only way to know is to get a test, whether that's a rapid test, which can be pretty good if you have symptoms, or you find one of those PCR-based tests. But there's a lot of folks who are going to think that they just have a cold and they probably have COVID. It's indistinguishable early on.
Wow, interesting.
A lot of news as usual. We'll see you next week.
You bet.
Good to see you, Dr. Pothof. Thank you.